Hey everybody, my name is Jesse Siwek. I'm a doctor of physical therapy and managing partner at Renew Physical Therapy in Tawas. And I'm here to give a webinar this evening on dry needling for pain and different other various musculoskeletal issues, as well as neurologic issues. So without further ado, we'll get rolling. So how does it work? That's the question everybody wants to know. So we're going to start with what is dry needling. Dry needling is a technique done by a trained physical therapist with the use of a monofilament needle essentially inserted into muscle or different tissues throughout the body, used for treatment of trigger points, pain, or muscle relief for various reasons. The biggest thing is everybody is going to say, is that acupuncture? And I tell people really similarly. There's a slide later that kind of describes the differences, but right off the bat, I tell people it's the same tool that an acupuncturist would use with the acupuncture needle. It's a single-use sterile monofilament needle, which is the reason we call it dry needling is because there's no gauge in the needle, meaning that there's no fluid transfer in or out of the body tissue. So there's no blood pulling out or there's no fluid going in to make that treatment. It's just the needle effect and the stimulation that the needle supplies. So how does it work? Needling into a muscle can cause reduced muscle tension, improve circulation, and normalizing physiological processes. Okay, so locally, if you reduce that tissue tension, you can actually reduce some of the stress on that tissue and the tension through there. Circulation improvements can cause essentially if there's inflammation in an area, if you increase the blood flow to that area, you'll actually get that anti-inflammatory effect that we're looking for through that circulation. That kind of leads into the third dot there, where we're talking about the normalizing of physiologic processes. I actually like that. So the way I describe it to people is by using that needle, you actually create a very small lesion in the body. Now, there's lesions of different sizes. So a large lesion would be if you have there's a lot of bleeding and other things like that. This monofilament needle is so micro size that it actually leaves a lesion that's really small, but can stimulate the same type of anti-inflammatory response that a larger lesion would without any of the tissue damage. So it's actually why that needle effect is such an important and pretty amazing phenomenon. So dry needling versus acupuncture. So dry needling is based on modern Western medicine. Obviously, that we are taking into account best practice as well as all of the biological and chemistry and physiologic effects that can occur with using them. We're looking at regulating your nervous system through your homeostatic responses, and you can treat on symptomatic and non-symptomatic points. So essentially, you can needle where it hurts at that very trigger point, or you could needle associated trigger points or different areas for different nervous system stimulation. Acupuncture, when I tell people in clinic what the difference between acupuncture and dry needling is, I actually tell them that acupuncture is working on normalizing the flow of qi, which that is the QI word right there. So qi is your body's energy force, according to acupuncturists and traditional Chinese medicine. Where I kind of tell people that, they've been doing acupuncture for a really long time. And, it's based on meridian lines, which is all about balancing your body's energy and your body's healing energy through different meridian lines. Those meridian lines are usually associated with like your stomach line or your spleen line. And those points are associated with different areas on the body. So acupuncturists will actually treat a meridian line where a physical therapist who performs, or a chiropractor or a DO will perform dry needling based on different nerve lines or different peripheral nerve lines, or based on different nerve roots of your spinal column. So it's a little bit more based on nervous system response or muscular trigger point response as opposed to meridian lines, which are the acupuncture lines. So I actually went to a school, the training for dry needling where I learned is called Integrative Dry Needling. They do it a little bit differently. There's a few schools of thought out there as far as like Western medicine dry needling, and most of those schools are based in like trigger point, where you're really trying to isolate a certain trigger point in a muscle, which is a little bit of a bundle of tissues that essentially bundle up because they're too tight, or there was a trauma to the area, or there's repetitive tissue stress or something like that. So a lot of those other schools of thought are based on just finding that trigger point and using the needle to express that trigger point, essentially. So in IDN, they kind of incorporate a lot more of nervous system work. So integrative dry needling, most of the needling points that we learn are all based on peripheral nerves. So nerves that come off of your spinal cord through different nerve roots and then travel throughout the rest of your body into your periphery, so out into your hands and your feet. And you're trying to essentially catch those nerves at different points in their travel. So instead of going directly after that muscle all of the time to try and express that trigger point, which again, it seems like it's slightly limiting to do that. IDN will actually stimulate different nerve lines, and you can actually treat the entire nerve all the way up to the spine. It also uses that kind of that systemic view, right? When we're talking about how you can treat that entire associated area. So all these tissues have different connections throughout the body and different movement patterns, and they're all associated via different nerves. So a cool way to look at it is, and we'll kind of get into that, is treating kind of the associated points instead of just going after the local tissues by themselves, which you can do as well. You can hit that trigger point, and then you can follow that line, that nerve line, all the way up to the spine, wherever it might be associated with. And you can also stimulate that nerve point at the same time. So they have a 3S model. Essentially, you can use the different needle locations can affect the body and how you can treat them. So a symptomatic would be essentially going after that hot tissue that's angry at you, that's essentially painful, and you're trying to express that trigger point at that symptomatic level. If you look at segmentally, you might be looking at the nerve that innervates that certain symptomatic tissue. So, for instance, if you're looking at like a trigger point in your forearm, it might be associated with your radial nerve. So you're not only going to hit the trigger point, but you're also going to hit the radial nerve points that are available through IDN. Systemic would be kind of looking at that full body type system where you hit the trigger point at the symptomatic level, you hit the segmental area through the radial nerve and the peripheral arm down through the lower arm, and then you're going to follow that nerve line up into the spine. That nerve actually originates in your cervical spine. So it gives you a lot of really cool treatment options as far as a framework for how a method to analyze as well as make your best clinical decisions on what aspects you want to actually utilize to get the best outcome for your patients. So that's kind of what we were just chatting about. There's a few different type of points that we would be using. Those symptomatic ones are kind of the direct hot ones that are, everybody can feel like when a tight muscle is all bound up. You can go directly at that, or you can follow that nerve. If you look at this picture here, you can follow that nerve line essentially up to the associated spinal level, whether that's because that spinal level has the sensory innervation or the motor innervation for the tissue that we're looking at. And then there's homeostatic points, which are kind of, I try and tell them or try and describe them to patients as, think of it like a nervous system reset or a nervous system like reboot, essentially trying to hit that entire area and encompass that entire area through the treatment there. Those are the points on the front for the most part, and the ones on the back. So those are the homeostatic points, if I'm not mistaken. I think they're missing a few. Yeah, there's a few on there, but those are all valid points there for where we would be trying to utilize for treatment. So obviously, it can be a little spooky when we talk about using a needle to puncture through tissue. Always going to be safety first. There can be some negative things that come from it. I have, knock on wood, never had any issues with any of them. One of the biggest things and the scariest thing that they like to say straight up at the beginning of a treatment session would be the most dangerous thing that can happen from a dry needling procedure, which is truthfully any procedure that you would use a needle around the rib cage, is called a pneumothorax, which is essentially you essentially puncture the chest wall, which doesn't mean that you necessarily puncture the lung itself, but by puncturing the chest wall, you can create a negative pressure in there that will actually collapse one of the lobes of the lung. And usually it's a pretty easily treated issue anyways. It can become dangerous if you become short of breath and if you really are struggling to get your oxygen levels corrected and that type of thing. But usually it's relatively treatable. So that's one of the biggest thing. And whenever you're needling around the rib cage or the chest cavity, essentially, you have to exercise the utmost caution. So there's rules that are set in place. Likewise with the kidneys into the lower spine. There's rules that are set in place for that. So the 1x1 and the 2x2 rules, which are essentially in those areas, you only come a certain distance off the spine with your needle point, and you're only using a 1-inch needle. So for instance, in your thoracic spine, which is your mid back, which is exactly where your chest cavity is, you're only going to come off one finger off of that spinous process, which is essentially the direct midline. And you're only going to come off of that one finger, and then you're using a 1-inch needle maximum so that you never are worrying about actually getting into the anatomical space that could cause an issue like a pneumothorax. Likewise, through the lumbar spine is the 2-2 rules. Essentially, it's a 2-finger rule where you slide 2 fingers off of the lumbar spine spinous process, which is that midline, and then you would use a 2-inch needle off of that, and then you're only limited to a certain amount of tissue that you can affect, so that you're not getting that needle into anything that could potentially be dangerous for the patient. Pregnancy is something that some people will say, getting a question real quick, I'm going to pull that up. So some people would say that pregnancy, there are, like in acupuncture, there's some forbidden points. The forbidden points are essentially, they believe they might stimulate, in pregnancy, they might stimulate the act of labor, of early labor, essentially. There's been some research shown on this that none of that is actually weighted in science, but acupuncturists believe that there are essentially forbidden points to use during pregnancy that you just do not do. That being said, with, you never want a patient to feel uncomfortable. We always talk about pregnancy. It's a pretty common thing that people know that people who are pregnant don't get acupuncture, or there's certain points that they don't use. If people are uncomfortable with it, I just recommend not doing it. I have done it. It's usually not my first go when people are pregnant, but I have used it when patients really just need relief from it. Later into their pregnancy, especially. So some myths. Number one, dry needling hurts. I'm not going to say that all of the needles feel great, but for the most part, most people just feel either an increase in pressure or very, very little at all, or the initial flick of the needle before the needle actually gets essentially threaded into the tissue deeper. There are needles that, if you hit that symptomatic point, you hit that trigger point, you can get called a twitch response, which essentially means that you're getting that needle close to the motor unit of where the nerve innervates that contractile tissue to contract the tissue. So you can get a twitch. Those ones can be a little achy just because, again, you're expressing that trigger point, you're expressing kind of that symptomatic area. And some people can feel a little sore afterwards. So I'm not going to say that dry needling never hurts. There are different responses that people feel, but for the vast majority of needle points, most people will feel a small pressure increase, but nothing else. And that's just because that monofilament needle is so incredibly small that it's not causing such a tissue damage, just because of the way that the diameter of it is so micro. Another myth is that all physical therapists can perform dry needling. You actually have to have some advanced training per state of Michigan. But there's some other states, so depending on where you're at, some other states where I believe all physical therapists can actually perform it. Michigan is not one of those states, though. I think the APTA, our governing body, actually suggests that all physical therapists have the training necessary, essentially a training through a course like IDN, Integrative Dry Needling, to continue. And obviously, dry needling and acupuncture, not the same thing. We kind of touched on that really early. The thing that I like to tell people again is same tool, different framework. Okay, so not treating chi. Dry needling is treating the human nervous system as well as muscular trigger points. I'm not hitting your stomach line number 5 to balance your chi in your stomach line. Some of the homeostatic points that IDN teaches, if you lay them over some traditional acupuncture points, there's a lot of overlap. And again, this is, radial line or radial nerve, deep radial nerve is a really common point that I use. And that's on most acupuncture points. And I think that acupuncture was onto something as far as, trying to describe the energy in the human body. And I believe that, we've in Western medicine and in current medicine, we've been able to demonstrate that most of these areas where there's high energy levels are really either high vascular or high exchange areas where there is something happening there. There's constant chemical reactions, there's constant cellular reactions, and those are all just stimulated by the different nerves that are in the area. So I think that, again, I think acupuncturists were definitely onto something way ahead of their time. So it's not the same thing. Same tool though. Same tool is what I like to tell people. So what are the benefits of it, right? We've talked about how you can increase that circulation by using that small lesion in the area. It can reduce muscular tension if you express that trigger point, so you can improve flexibility. Pain management, there's something called the needle effect that's actually relatively well researched. So a lot of pain management it will be based around, so a pain management clinic will be based around corticosteroid injections or injections of some sorts to reduce pain. There's actually been some interesting studies out there that put up a dry needle, essentially, where there's no fluid exchange versus a corticosteroid injection, or an injection that does put a direct anti-inflammatory into the system. And there are some pretty interesting results from that, where there's similar outcomes, regardless of whether or not there's actually a fluid being injected that is supposed to be a medicine, or if it's just the needle. So they call that the needle effect, where this needle entering the system, kind of disrupting whatever signal was coming from that nerve, and getting a reboot in that area, has a really good response on pain management. And that, again, will kind of in turn reduce inflammation in the area, and then can restore that tissue to its normal homeostatic condition. So conditions treated by dry needling, really all through the musculoskeletal system. So low back pain, neck pain, headaches are a huge one that I use needles for, whether that's through upper cervical spine and the neck, or actually through skull and some of the facial points that we have learned. Shoulder pain is another really good one for people, where you can needle into certain muscles in the shoulder to, again, get that anti-inflammatory response, express a trigger point in the shoulder, or just work that line from the cervical nerve root all the way down through the lateral shoulder on the outside shoulder. So hip and knee pain is another good one. When you start getting into the lower legs, there's quite a few good points to use for foot and ankle pain, hip and knee pain. Usually if I'm needling into the lower leg, I'm usually needling up, because there's almost always something associated. If we're dealing with foot pain, we're almost always dealing with something going on at the knee and the hip, whether or not it's symptomatic at this point. So I will usually try and connect the dots. One of the things I like to say to patients about, if I'm trying to describe why I'm needling somewhere that doesn't necessarily hurt, right? So let's say it's your right foot that hurts, and I stick a needle in your right foot, in your right calf, and in the backside of your hamstring, people will be like, why are you needling all the way up there? And I will say to them, obviously I'll tell them about how all these tissues are connected, they're all incorporated, they all move together essentially. But if you look at it, I'm trying to talk to your brain, and I'm trying to place a pin on Google Maps for your brain. And these little needles will be that pin. They'll drop a pin and allow your brain to get constant feedback from that area. And essentially all of the associated tissues with that right foot will be getting this feedback and this anti-inflammatory response and this tissue restoration. So I really like that type of visual for people. It kind of sets home for like why I would be needling away from where their pain is. Elbow, wrist, and hand, there's tons of trigger points with people who are on computers or on their phones or whatever it might be that could be utilized. Likewise, if I'm doing elbow and wrist, I'm almost always working my way up to the shoulder or neck as well. And then different muscle tension. My wife actually will get like restless legs sometimes. I'm sure she would be fine with me telling you guys that. She gets restless legs sometimes before going to bed. And 100% of the time, if I needle 2 points in her calf, they go away immediately. And I think, again, it's kind of that nervous system stimulation, that dropping that pin on Google Maps to get that feedback to your brain. And essentially you're expressing the trigger point while getting an improved circulation in the area. So really, there's so many different things that can be treated by dry needling. It's really quite a fascinating tool that has become a huge part of my practice for the last couple of years. Here we've got some pictures. Okay, so up here on the top right there, those are the thoracic paravertebral points. So that's kind of in accordance with that 1-by-1 law, where you're only using an inch-long needle and you are needling 1 finger width off of the spine. The upper left there is some of the cervical points we would be using. So some people who get, like neck pain or headaches that originate from the backside of their neck, the one that kind of creeps from that suboccipital region through to the back of the eye or over top and sets above the eye. That's one on the very bottom there that's your superior cluneal nerve. So that's a really, really heavily associated low back pain nerve. So that's kind of one of the connecting nerves from your low back to your hip, where there's a lot of communication going on from your pelvis to your lumbar spine through that area. And by needling that nerve specifically, you can actually get a lot of good results there. So these are a couple more pictures of just the application of the needle. Again, in the name of safety, the studies have been shown that the gloves are actually for the therapist performing the needling procedure than it is for the patient. But I like to think of it as both ways, where it protects the therapist from bloodborne pathogen that might be that the patient might have. So again, there's single-use sterilized needles. The application of them, I'll actually give a little demonstration here in a minute about how to do it. This is a picture of all of the IDN trained therapists in Renew Physical Therapy. Again, these are across all these varying locations. The highlighted locations on this one is offered at Bridgeport, Midland, and up in Tawas here. And then I would like to do a small demonstration on how you do this. Let me see how I can get my screen back here. I'm going to stop the screen share. And let's see. Okay, so I'm just going to roll my sleeve up here. I busted out a needle. And I completely forgot to mention in the very beginning that there is a Q&A that's available through the Zoom here. If you guys have any questions, by all means, please ask. So hit the Q&A button and submit those questions, and I'll answer them before we take off here. So I'll leave that a little bit more open so that you guys can generate some of those questions. Apologies for not saying that in the beginning. So essentially, you take this needle that's in a guide tube. Okay, they are so small. I don't know if you guys can really see that. Okay, that needle goes through a guide tube. So essentially you're using that guide tube so that the needle doesn't get all flimsy on you when you put it on somebody's skin. You rest that guide tube. Let's see, I'm gonna get a better view for you You rest that guide tube onto the patient's skin. You flick that needle so that it gets stuck into the patient. So you essentially clear that first bit, and then all you do is you slide that down further. And just to describe kind of what I felt, you feel the pressure initially of the needle going in, or the flick that happens, and then after that there's a small aching sensation. That aching sensation is actually what the acupuncturist will call the chi sensation, the changing or the restoration of that energy flow in the area. So if you can see it kind of hanging out there, I'm going to just slide it out. And that's the needle. No blood, no nothing like that. That is the process. Pretty simple. In execution, pretty darn simple as far as using the tool. It's the framework that really makes the tool useful to people, because again, I think having the ability to hit each trigger point individually, but then kind of extrapolate that view and take it out to the full body or full nervous system, or the nerve line or the different fascial lines that you want to work with. It's really, really, really beneficial. So I see here, I've got a question saying, any conditions that are contraindicated essentially. So there's no contraindications. There are some things where if you have a really compromised immune system, that would be something we would be thinking about, as far as like you're higher risk for an infection. Anytime you break the skin with any procedure, you're at a risk for infection. Again, there's single-use sterilized needles, so I think that risk is relatively low. As far as myasthenia gravis, I know that's an autoimmune disorder, if I'm not mistaken, or at least started from an autoimmune disorder. I've actually treated a bunch of people. I used to work at a chronic pain clinic down in Grand Rapids, and I've treated a bunch of people with autoimmune disorders with dry needling. And I think why it helps so much is because you get a lot of change through the tissues without having the same output. There's not the same energy output. People aren't exerting themselves a lot to get to these type of tissue changes. And that's not to say that they don't need to be followed up with these, stretches, exercises, strengthening routines, and different, neural activities. But you get a really quick change, and that kind of feeds into my next question there on the Q&A. How long does it feel to take the effects of dry needling? Generally, it's pretty immediate. Some people will feel that relief right away. Every nervous system, every human is a little bit different. So a lot of people feel an immediate change of some sorts. Some people will get a little sore afterwards. Like if you're really hitting those symptomatic points, like say you have a couple trigger points in your shoulder that you're really going after, there's a good chance. it would be similar to somebody sticking their thumb in there and really working on that tissue, except it's just the needle doing the work. Some people, on the counter of that, some people, if you hit those symptomatic points, if you hit it and express that trigger point, they have no discomfort anymore. It's pretty amazing. I have had those kind of like one and done needles. It doesn't happen all the time. It's not very frequent, but I have had those like one and done needles where it's, like you hit the one spot, there's a big twitch in the muscle, and then like that person's issue is gone with the continuation of exercise prescription essentially. I have another question there. It says, can you treat a patients who have a port in? And it's all kind of depending. I would say yes, depending on where we're treating. Can it help with a Baker's cyst? I have never needled directly into a Baker's cyst. I've needled around Baker's cysts, and I've had patients say that they disappeared afterwards. I've never claimed to pop a Baker's cyst with a needle, but what I would say is it can definitely calm the nerves down around a Baker's cyst to try and get rid of the inflammatory response that's being caused by that excess pressure by the cyst there. I'm hoping that answered everybody's questions. Those are the only ones I have on there. Does anybody have anything else they'd like to ask in the Q&A there? Again, I'll wait a little bit if you guys are kind of formulating. Just to give a few more minutes to allow anybody to kind of process.
I'll mention while we're waiting too, for everybody that joined, we'll be sending out a follow-up email that has Jesse's contact information and also the recording for this webinar if you'd like to rewatch, so you can look out for that as well.
So if you take this webinar and you're kind of chewing on it tonight and questions show up, by all means, send an email my way. I'm more than happy to strike up a conversation about it. All questions welcome. I've been dry needling since 2000. Let's see, it would have been pretty early, no, late 2018. So I've been dry needling for quite a while. It was really quite evident as a student. I had a mentor who did it and he used it on me a couple of times, and I realized just how quick you could make a change with people. And that's not just saying, hitting those symptomatic points, but it's more about hitting, the associated nerve lines and like reducing neurologic type pain. I've used it for vertigo and different neurologic disorders and different balance disorders. It's really a great tool to use to really focally ask your nervous system to tune up a little bit and ask that brain to pay attention to what's going on in that area. So I'm not seeing any other questions pop up. I think that will probably wrap us up then, guys. I appreciate you taking your time tonight out of your evening to spend it with me and learn a little bit. Again, if you have any questions, shoot me an email, strike up a conversation, and we can direct you to some help, hopefully. So if that's it, have a wonderful evening.
Sounds good. Thanks, Jesse.